Good morning, everyone. This is Mary Alcacer from KNA Wellness Center. I am the program manager at KNA for the last couple of 11 months, so almost a year here, and super excited about our mini seminars. We have a total of 9 seminars throughout the year. So we're almost over. So we have this seminar and we have our upcoming seminar in December 12th. So please stay tuned for that. And I'm happy to be here with these amazing people. So we have our amazing partner, Tiana. We work with her throughout the year to have 3 reproductive health mini seminars. So thank you for being here, Tiana. It's so great to always work with you and be present, talking about so many interesting topics related to the sickle cell community in trade as well. So, as you all know, Cayena Wellness Center is being present in the community for about 20 years. And we are working so hard to get you all the resources, the education, the awareness, and the advocacy that you all need in the sickle cell disease and trade world. So we are excited now to present Tiona Wolford and also Dr. Said, who are our moderators for today. So I will hand it over to you both. Take it away. Thank you so much.
Thank you, Mary. Thank you for that introduction. And everything you said is so true for us as well. We at SCRED are honored to be able to have this partnership with Cayenne Wellness. It's been an incredible platform, to really bring awareness and attention to things that otherwise would have gotten overlooked. So, at Sickle Cell Reproductive Health Education Directive, which we call SCRED for short, our mission is to advocate for high quality reproductive health care for individuals living with sickle cell disease of all types. And I'm really excited about this particular seminar because I think that because of my own personal story with infertility, a lot of people think that SCRED is a women's health organization, but it's not. We are all inclusive, realizing that the men in this community have their own issues, and one of them is priapism. And before we go any further, I have to give a shout out to Demetrius Wyant, who was really the inspiration. Had it not been for his influence, it's quite possible that SCRED would have been a women's health organization. He's somebody that has been so transparent and vulnerable about his experience with priapism. He has his own initiative, he has a documentary, and so much of what he does revolves around bringing attention to priapism. So I'm really honored. I know that he is catering an event today, or else he would have joined us. But so we did our first one on pregnancy and fertility, and we're wrapping it up, making it all about the guys, and gonna get more of a glimpse into what they deal with involving priapism. And I'm excited to be joined by Dr. Ayo and Dr. Zaidi. Dr. Zaidi is my board chair, and he's going to co-moderate this discussion with me. So I'll let you take it away and fill in any gaps that I may have missed.
Thanks, Tiana. No, you covered everything beautifully. One of the great joys in, being in the sickle cell space is seeing, young, energetic people come into the space and bring their passion. And the speaker today, Dr. Ayo, is really a good example of that. So, Dr. Ayo grew up in Southwest Nigeria and has been familiar with sickle cell disease from a very early point in his life, growing up around medicine, around individuals with sickle cell disease in a very intimate way. I was sort of, looking up some of his contributions, before this meeting, and I came across an article, and I wanted to include some of his words in his introduction because I think it really speaks to sort of who he is. He talks about how only through a combination of healthcare advocacy and clinical research, he hopes to raise awareness amongst the scientific community to the disparities in care for children with sickle cell disease. His goal for his career being to find ways to implement culturally acceptable, affordable, and accessible comprehensive care for children with sickle cell disease anywhere in the world. So I'm sure all of you can agree that, people with this kind of mission and, this type of energy is exactly what we need. So it gives me great privilege and honor to be able to introduce Dr. Ayo to the community today. And I invite him to share his thoughts with us on a debilitating symptom of sickle cell disease, priapism. Dr. Ayo.
Thank you so much for that kind introduction. It's a privilege to join you all here today to talk about priapism. Do I add my slides on here?
Yes.
Okay. Okay, so today I'll be talking about priapism and sickle cell disease. This is my overview of the talk. So I'll give a brief presentation about one of my patients who I consider a friend and the struggles he's had over the last couple of years. And then we'll briefly introduce what priapism is. We'll talk about the many different causes, and then we'll focus on how prevalent it is in the sickle cell population, how we treat it, and how we can prevent it. So my friend is a 12-year-old African-American male with sickle cell disease. He had the SS genotype, and he had recurrent priapism, and it took a long time before we got it under control. He had an episode, initially started about 1 episode a month, and then became about 4 to 5 episodes every month. Each episode would last about 1 to 3 hours, and none of the episodes seemed to improve with just conservative therapy. He would try to stay hydrated, warm baths, exercise, would try to urinate. None of that worked. He even tried Sudafed, which is a sympathetic agent at bedtime. That also didn't decrease the frequency. With each episode, he would go to the ER, and whenever he got to the ER, he'd typically get pain control in the form of IV opioids and IV fluids, and about the 3-hour mark, he would recover spontaneously. However, he had 2 episodes that lasted about 4 to 6 hours. The first one, they had placed a dorsal nerve block, which is where they inject the penis to try to relieve the pain. And when they did that the first time, the episode resolved. But the second time, the urology team had been consulted, and the episode had lasted 6 hours. They were about to do an urgent aspiration and irrigation. And as soon as they were about to start, that episode recovered. As you can anticipate in a 12-year-old male, he had a lot of anxiety regarding this episode, and we had to give him significant ongoing psychological support. His mother had previously declined hydroxyurea therapy because of concerns about possible toxicities. However, when these episodes became a lot more frequent, they both agreed to start hydroxyurea. And when he started, he had great compliance with care. His hemoglobin F increased rapidly to above 20%. But then we still didn't have any improvements in these priapism episodes. And at that point, we had talked about possible options of care, and we decided to do a trial of transfusion therapy for 12 months. After 2 months of transfusion therapy, fortunately, these priapism episodes decreased from the 4 to 5 episodes a month to no more episodes. But at 12 months, again, we revisited the risks and benefits of ongoing transfusions, and we decided to stop and continue hydroxyurea and watch. And it's been a year since then. His last episode was 9 months ago, and he continues to follow up and seems to be doing okay. So what is priapism? Priapism is a penile erection that lasts longer than 4 hours after completion of sexual activity, or that is completely unrelated to sexual activity. It is a medical emergency because any delays in treatment can result in permanent damage to the penile tissue itself and permanent erectile dysfunction. There are many causes of priapism. Sickle cell ranks among the leading causes, and other blood disorders like hereditary spherocytosis, G6PD deficiency, which is also prevalent in our sickle cell population, may also predispose to priapism. I'll talk a little bit about why later. Trauma to the pineal gland itself can also result in priapism, and certain kinds of recreational drugs can also trigger priapism. It's estimated that around 4 in 10 males with sickle cell disease will have at least one episode of priapism in their lifetime, but most clinicians believe that this number is grossly understated, especially because a lot of people may not report it because of shame, embarrassment. They may not know that this is a part of the disease. This can also hinder early access to care. Any age can be affected. It typically starts around the time of puberty, and they say about 9 in 10 males would have had one episode by 20 years of age, which is quite remarkable. As you can imagine, recurrent priapism can severely impair one's quality of life. A subset of individuals can have weekly symptoms or even daily symptoms, and this may require multiple visits to the ER, significant embarrassment, especially for a teenage growing kid or an adult at work or somebody who's just living their normal life. It can cause significant social isolation, depression, anxiety disorders, poor school performance. In one small study, 30% of children and adolescents with priapism described priapism itself as the worst complication of sickle cell disease, even beyond the recurrent pain episodes that they had. This image is just briefly to illustrate the blood supply to the penis. So on the top left, you have if you look, I don't know if you can see my mouse. Can you see it? So on the top, oh no, you can't. Okay, so on the top left, you can see the just anatomical diagram of the penis. You see two round structures, and then there's a smaller round structure below. So above those two round structures, you have the central vein, which is blue, and then there are two arteries next to it. So the arteries supply blood to those two central structures, and the vein takes blood away from the penis. At the bottom right-hand corner, you see what happens in the erect state and in the non-erect state, or the flaccid state. So the flaccid state is on the left, and those two round structures, the corpora spongiosum, they have like pools of blood in them. And when the penis is non-erect, the blood vessels are constricted, so blood flow is not a lot in the penile tissue. And the veins are largely open. The veins are the blue ones at the edges, and the veins drain that blood out. However, when you have an erection, you have blood pooling into those corpora spongiosum venules. And because the blood pools into the tissue expands, and then it constricts on those veins, and the blood gets trapped in there. So what happens in priapism is when you have any reason for an erection, which may be sexual stimulation or maybe awakening in REM state, which is a physiological trigger for some erections. If this gets prolonged for 4 to 6 hours, the blood gets trapped and then it starts to lose the oxygen. It becomes more acidic. You may have blood clots, and it becomes intensely painful. And because the veins are compressed, the blood doesn't flow out and it gets trapped in there, and the tissue may die because there's no more fresh oxygen coming in. And this is, we know what happens molecularly. Very briefly, there are two pathways that are involved. So there's one called the cyclic GMP pathway, which is responsible for contraction of those blood vessels. And then there's the PDE5 pathway, which is responsible for relaxation of those muscles. In sickle cell disease, The blood has lower levels of nitric oxide, which makes the tissues more sensitive to contraction and less likely to relax, if I can illustrate it easier. There are two main types of priapism. There is the low flow priapism, also called the ischemic, which is what I described earlier. It's the most common form, and it affects, it's the one that causes more than 95% of cases. And then there's the high flow priapism, or the non-ischemic, which is seen in less than 5% of cases. In the ischemic or low flow priapism, that's what we typically see with sickle cell disease and other blood disorders, because the blood gets trapped in this tissue and there's no fresh blood coming in. There's no venous drainage of the blood that's trapped. And so it gets ischemic, meaning there's no new blood coming in. You don't get any oxygen to the tissues and the tissues may die. The non-ischemic form is when you have, most frequently from trauma to the penis, where the artery creates a channel with a vein and you have like an arteriovenous fistula, and the blood flow is constant and you often have increased blood flow, but it's less likely to cause irreversible damage. And then the stuttering or the recurrent ischemic is a form of the low flow priapism where you have recurrent episodes of ischemic priapism that resolve spontaneously. But a lot of studies have shown that individuals who have stuttering priapism are more likely to have an episode of a major priapism down the line if it doesn't get treated. And that's what I illustrated on this next slide. It's very important to distinguish for clinicians between ischemic priapism and non-ischemic priapism because the treatments are completely different. With ischemic priapism, the penis is usually fully rigid and very painful, not so much with non-ischemic priapism. And if they were to check the blood, if they did an aspiration of the penile gland, they would find that in ischemic priapism, the oxygen is quite low and the blood is quite acidic, suggesting that it's been trapped in there for a while, which is not what we typically see with the non-ischemic form. And there's often a history of trauma, recent trauma to the penis with the non-ischemic form, unlike with the ischemic form. So what are the goals of care for priapism and sickle cell disease? The most important one is we want to relieve the acute pain. And this may be in the form of oral analgesia, but by the time they get to the ED, we could give IV opioids. You also want to resolve the acute priapism episodes because we know that an episode lasting longer than 4 hours increases the risk that the penile tissue becomes irreversibly damaged. We also want to preserve the erectile function so that after resolving this episode, the individual doesn't have any problems maintaining an erection for physiologic needs later down the line. And we also want to prevent future episodes, not just because of the cost of the healthcare system, but also to the quality of life of the individual. So how do you manage priapism at home? And this is only for cases that are typically less than 3 hours. Some individuals who've had recurrent episodes sometimes have certain activities that they have tried in the past that may relieve those symptoms. And if they know those, they could do that again. So some people say exercise may help relieve some episodes. Some individuals say having a warm or cold shower may help. Some people say after urination, but some say that those also don't work. So there's no strong evidence for or against any of these. The one generally agreed thing is that maintaining proper hydration is important because dehydration sometimes, in some studies, has been linked to the likelihood of priapism. Again, I must emphasize that it is crucial not to delay seeking care, especially when it happens, because the time is ticking. Any episode lasting 4 or more hours is considered a major episode of priapism, and irreversible damage can occur anywhere from 4 to 6 hours or longer. in some case reports, they have documented some individuals who unfortunately sought care around the 36-hour mark. And the likelihood of erectile dysfunction around that time is about 90 to 100%. So it's really important to seek care as quickly as possible. At least call your hematologist for guidance. And typically what you would expect for major episodes is from the ED would consult urology, and they would do possible irrigation and aspiration, and they would also administer some medicine to make the blood flow better. This might look a little too tiny, but again, it's just to show like the typical flow chart for when an episode occurs is we take a brief history and physical and then determine how long the episode has been going on for. And then depending on what type of priapism it is, if it is the ischemic, the typical plan would be consult urology urgently, and they try to get to relieve the episode. For the non-ischemic priapism, which is not typical with sickle cell disease, oftentimes they may just observe, or they may do surgical procedures to stop the arteriovenous fistula that may have caused it. So how do you prevent priapism? I think the most important thing is actually early education of the patient and the caregiver. Providers also have a certain sense of discomfort when they're talking to, say, a 12-year-old male and his mother about complications of sickle cell disease, and they may not want to talk about priapism. So it's important to make sure that providers feel comfortable talking to both the patient and whoever the caregiver is about what priapism is, so that they know early and they know what to do. The second thing is hydroxyurea has been shown in some studies to decrease the frequency of priapism among certain individuals. You might think it is counterintuitive, but in some studies they showed that Viagra, which in the regular physiologic population, Viagra stimulates an erection. But because of the changes in the nitric oxide in sickle cell disease, in some patients, Viagra actually helps to decrease the future episodes of priapism. So in patients who've had episodes of priapism and they've been on hydroxy and haven't had any benefits, some of their hematologists may offer sildenafil or tadalafil to help decrease future episodes. Again, the evidence is kind of mixed, although it does lean towards preventing multiple episodes in some patients. Some patients have also found benefit with the use of alpha-adrenergic agonists like pseudoephedrine, ephedrine, and ethylephrine. Again, doesn't work in all individuals, but it may benefit, especially when there are multiple episodes and previous suggested options haven't worked. And another option is chronic transfusion therapy. You could potentially do a trial of transfusion therapy, but as we know, major side effects include the risks of alloimmunization, iron overload, transfusion reactions, and the likes. Anti-androgens have also been described. However, side effects, especially in pubertal boys, might actually limit its use because it may cause gynecomastia and may affect the normal pubertal trajectory, may decrease the final growth height of the individual. And finally, there is an ongoing clinical trial of crizanlizumab or Adakveo, and what crizanlizumab does is it inhibits the P-selectin inhibitor in the vessel wall and helps to decrease vaso-occlusion. And from some of the centers that have been enrolling participants for this drug, they have noted significant improvement in decreasing the frequency of priapism episodes. This clinical trial is anticipated to close sometime next year. So we're all optimistic that we may have another therapeutic agent that may help relieve this dramatic side effect or complication of sickle cell disease. That's all I have. So to conclude, priapism is a penile erection that lasts 4 hours or more after completion of sexual activity or completely unrelated to sexual activity. More than 4 in 10 males with sickle cell disease, whether SS, S beta plus, SC, even some individuals with sickle cell trait have been described in the literature. And we believe that this is highly underreported because of the shame and embarrassment. But I think it's also important to normalize talking about it so that individuals can seek care early. It is a medical emergency, and any delays in treatment may result in permanent erectile dysfunction. Our major goals of resolution of priapism are to help with the pain, resolve the acute event, prevent permanent erectile damage, and also prevent recurrence of this episode. And hopefully sometime next year, we should hear good news about crizanlizumab helping to decrease the prevalence of priapism. These are my slides. I'm eager to hear your thoughts, questions. Thank you for listening.
Thank you for that excellent talk, Dr. Ayo. That's a very nice scientific synopsis of priapism, which of course is a debilitating symptom of sickle cell disease. I think to facilitate our conversation, what we should do is pull in some of our panelists. I'm going to ask Tiana to introduce some of our panelists who will help us explore this subject in more detail.
Yeah, I am so excited to bring up my panelists. They have just been so gracious to join me because, I kind of asked them a little bit last minute. So thank you to James and Ernest. And I really like what you said, Dr. Ayo, about, wanting to remove the stigma out of this. And that's my goal as well. And so I'm really grateful that Ernest and James are going to help us do that. And just personally, I want to thank both of them because I know that this is incredibly personal and it takes a lot of guts to get on here and share these intimate details with you. But before we do that, I do have one question for Dr. Ayo, just for my own understanding, because I think I probably got lost a little bit. Can you explain to me why you said that Viagra can actually help?
Yeah, that's a great question. It's very counterintuitive. So they say that in the pathway for normal erection, you have two major things that happen. So the first part is the cyclic GMP, which is what stimulates the smooth muscles to contract. There's a second arm of that balances the cyclic GMP, which is the PDE5. I don't know if you know enough about Viagra, but Viagra is a PDE5 inhibitor.
Oh.
So PDE5 itself is what relaxes the smooth muscles, and they're in a constant state of balance in anybody, whether or not they have priapism, sickle cell disease or not. In sickle cell disease, we have low nitric oxide in the blood. And so you have low levels of this cGMP and also PDE5. And they're so low that any imbalances, so if you have a supernormal stimulus for any erection, the PDE5 can no longer compete and it can't balance it. And so if they inhibit the enzyme that breaks down the PDE5, it kind of balances out that abnormality and it helps to make symptoms better. That's what they think. And in some studies, it's shown that it may benefit, but it's not a dramatic change in outcome. Did that help?
Yes, that did help. Thank you. You taught me something new today.
And Dr. Z may help because he knows a lot more about it than I do.
No, I was going to say this is something that has always confused me too. And the way I like to think about it is sort of as Viagra allows for a reset of the environment, right? So there's such an imbalance in the way that erections are being sort of processed in the body. There's such an imbalance there. It's such a strange microenvironment because of sickle cell that when you add the Viagra, it almost creates a little bit of a reset to the thermostat to make it a little bit more manageable. It's a very counterintuitive concept, but it does work for some patients, and it works quite well for some patients, certainly.
That's really good. So is there ever a time when like you use too much of it and then it can actually make things worse?
So, you know, one of the things about priapism is that the clinical experience for sickle cell disease physicians and priapism is not huge, right?
Mm-hmm.
Like, we deal with it, we see it, and we manage it when it comes along. But oftentimes, warriors are just suffering with it on their own. It's not something that always gets the attention it needs. So what happens is that our ability to really come up with a good strategy, understand appropriately, create the right treatment guidelines is limited because our experience is also limited as physicians. So I can't tell you that I have that much experience with priapism. I mean, the ones that I see are the maybe 1% of priapism episodes that land people in the hospital, right?
Mm-hmm.
So I missed the other 99%, which makes it hard to really give you a good sense of what happens with some of these nuances.
Okay, well, we'll add that to SC Red's list of things to develop some priapism guidelines. Okay, but James and Ernest, thank you again for joining us. I'm going to let you guys start by introducing yourself, and then we'll jump into the conversation. So James, I'll start with you, like who you are, what you do.
Hello, my name is James Duncan, full-time dad, sickle cell, SS. Yeah, I think that's it.
Okay, there's so much more that you could have said, but I'll leave you alone. Ernest, tell me about you.
Hey, I'm Ernest. Nice to meet you all. So I do a little with Kate. I'm on TikTok, so I don't know if you're on TikTok and you search sickle cell, you'll definitely see a few of my videos. So that's
an influencer. Okay, nice.
Yeah, so I'm just here to support and learn more about priapism.
Yeah, I didn't know about the Viagra thing. I never knew that.
Yeah, that's fascinating. Well, Dr. Z, I'll let you start it off.
Well, I think for me, guys, I always say that everything I've learned about sickle cell disease comes from talking to patients, and we're just thrilled to have you here so that Dr. Io, and myself can learn more about sort of day to day. I want to hear about, when did you sort of realize that priapism is an issue? It does happen in sickle cell disease. At what age did you guys start dealing with this in sickle cell?
I started at 15. I was home, and then it just went up, and I thought it was, just like, okay, it's just up. But then after like 40 minutes, it's like, okay, something's not right. And then it starts hurting. So I go to my mom, and, she's like, okay, I think we got to go to the hospital. And then when it starts turning red, that's when you know, like, yeah, there's something really wrong. And ever since then, I've been dealing with it off and on, once in the blue.
Mm-hmm.
But you're right. We don't go to the hospital. Like, we usually don't go to the hospital. We try to handle it at home because it is embarrassing. Like, it's very embarrassing.
So when it happened that first time, did you know that priapism was a potential symptom? Oh, you did not know?
No, we didn't know. We just knew that, 45 minutes of it just being erected, like full force for no reason. And then it starts to ache, like something might be wrong. So when I go to the hospital, that's when they sit there and say something about priapism. And I still don't know what that is. They're like, yeah, that's usually a crisis in the penis. And I'm like, you can have that? Like that can happen? And that was the first time I've ever heard about that.
So to me, and I want to hear from Ernest in just a second here, but so your mom also had not been given a warning from the sickle cell physicians that were seeing you. See, for me, that is a really important piece to this story that we're talking about today, which is doctors are not doing a good job of educating and preparing adolescent teenage boys and their caregivers about this issue and sort of what to expect. I can imagine that it's super scary to go through if you have zero idea that this is going to happen or could happen.
Well, see, the problem with that is that that's with everything with sickle cell. We don't learn about what happens with you until it happens. We don't know about necrosis. We don't know about the retina thing. We don't know about scoliosis. We learn when it happens. That's when they're like, oh yeah, that can happen, by the way. Yeah.
That's deep.
Mm-hmm.
Wow. Yeah, I mean, that puts a lot of, that gives me and Dr. Ayo a little bit of urgency in how we're educating and helping people anticipate what happens with sickle cell disease, because you're right, man. I definitely feel like sickle cell catches people off guard all the time.
A lot. A whole lot.
And that's a lot on the doctors, because we're not preparing you for, when things can go bad. But Ernest, let's hear from you, man. We didn't get a chance to hear about your story.
Okay, so for me, I haven't experienced priapism to that extent to where I had to go to the hospital because it aches, or I never had an ache from that period, but I have experienced, just like prolonged erections at night. So like if I wake up in the middle of the night and go to the restroom, I'll see that I'll be erected, or sometimes I just wake up. And I thought that was normal for a while, but I never had it to that extent like James has. But
so that's quite telling, right? Because it shows us the gradient of experience that you can have with this problem. I'm curious to hear about how, this is already a complicated thing as a teenage adolescent boy that you're going through, and you're trying to learn, how to go through puberty, how to have experiences that are sexual in nature. How did this play into like your mindset around that? Did this create fear? Did this create anxiety? Did this create issues as far as that process in your life?
How graphic can I get?
As graphic as you need to be.
Okay. It makes you anxious because, as a guy, you wake up in the morning and you usually have a morning wood or something. So when you sit there and you dealt with priapism a few times, once it's still up after 5 minutes, your heart's beating and you're like, oh my God, I think I'm gonna have to go to the hospital. Or, you sit there and you get aroused and you get too aroused and you feel like a little funny feeling down there. Once again, you're like, oh my God, is this priapism again? So it definitely does play with your mind a lot.
What about you, Ernest? Like, what did it do to you mentally?
Well, like I said, I don't have that same experience as James, but I just thought that it was normal. But as I started, educate myself, because I went to FAMU and got a degree in biology, so I learned about priapism then. But so I was just like, okay, maybe I just have a low case of that. But I just learned to, just deal with it. I never spoke about, hey, I've been erected. I'd be erected at night for a long period of time. So I just go back to sleep. But fortunately, I haven't dealt with that anxiety of thinking just because, I'm erected in these different cases, I might have to go to the hospital. So I just always thought that it was, just a mild case of it. And I just, just dealt with it, go back to sleep. And like you said, when you wake up in the morning, I thought that was regular for boys. But I still had that as an adult, waking up like that. So I just always thought it was regular.
Okay. So Dr. Ayo, I'm going to pull you in here. It looks like we've got a question from the participants. Can you tell us a little bit about if there is a difference in how priapism affects different genotypes. Is it more common in SS? Is it more common in SC? Does it matter?
That's an excellent question. So the first thing, again, to like the caveat is the data is limited, but evidence suggests that it is more common in SS genotypes, but all genotypes can be affected. There are even case reports of individuals with the trait, sickle trait. So my brothers at home could get priapism just because they have one S gene. So everybody can be equally affected. And again, prolonged episodes, regardless of your genotype, is particularly dangerous. Did I answer that question?
Absolutely. Thank you. T, do you see this question that we got from the audience? I'm gonna let you sort of speak to that because I know that we've talked about this in the past.
Yeah, I will take that. So I guess it was like a year and a half ago, somebody brought it to our attention that this could happen to women. It was my first time hearing that. And I have to be honest with you, I only heard it from one person and I kind of let it go. But I was recently doing a fireside and several women on there said that they had had clitoral priapism. And so when I spoke to one of my researchers about it, they said that it made sense and they thought that it was around sexual arousal. But from what I heard from the other warriors, it had nothing to do with sex. So it's definitely something that I have heard, but I don't have enough information on it to really answer that.
Can I add to that?
Yeah.
So I have a friend that is trans, is going from women to men, and right now they're going through puberty because things are growing down there now, and because they're growing down there, they actually experience priapism too. So that's also something that I guess is going to be something new that the hospital sees.
Yeah, that's a really good point. I mean, we are certainly SC Red talks about sort of the entire gender spectrum and the advocacy that's required to make sure everyone gets fair representation. I mean, you can look at this, right? So we're talking about sickle cell disease disparity. We're talking about priapism within sickle cell disease for men disparity. Yeah. We're talking about clitoral priapism, right? That's an even smaller portion, even less awareness, right? So then you add to this, transgender, gender reassignment and things like this. This is truly an area we don't know enough about, and certainly something we're going to have to really start giving some really, really close attention to. One of the questions that just came in, Dr. Io, is talking a little bit about remedies for priapism, and I was wondering if you could give us just a short overview on the general management. Let's talk about outpatient management, specifically techniques, medicines that you talk to your patients about.
Yeah, that's a great question. So outpatient management, the first, I'll try to debunk some myths, but I'll also talk about what some people have said works for them. So the initial thing that most clinicians agree on is that dehydration may trigger an episode of priapism. So it's important to make sure you stay hydrated. The second part is priapism, for some reason, typically doesn't happen when you have other complications of sickle cell disease going on at the same time. So like when you're having acute chest, it's unlikely that you would have a priapism at the same time, but it's important to pay attention to that as well at home. The next thing that's important to do, some folks say if you have a warm shower or a cold shower, it may help. Some do warm or cold compresses. Some report that masturbation may relieve the pain and may relieve some episodes, but doesn't always relieve episodes. I see James shaking his head. So
that's the worst thing you could do.
Right. And the evidence is very mixed, but lots of people write those down. The other thing some people have said is that perhaps urination may help. But then again, this may be debunked. So normal if you don't have priapism, if you wake up in the morning, when you're going through REM sleep, it's normal to have some erections. And that may be the trigger for priapism and sickle cell disease. but then you're just waking up and you also have to go to pee. So some folks may go pee and then have a resolution and may think that the urination was the one that relieved the priapism, but it isn't. So to summarize, the main things that help are staying hydrated. You can try warm or cold compresses. You can try exercise. And if that doesn't work, I think seeking care early is the most important thing. And I also get what James was saying about that inducing anxiety, because then when anything happens now, you start worrying about the clock. And for those who this happens 2-3 days a week, this can be completely devastating.
Yeah, because they told me, they was like, hey, if it don't go down in 15 minutes, we're going to have to drain it. They come in the room with a big needle. I'm like, oh, no, this is not okay.
Yeah.
You did not have to do that?
Nah, I don't know. It must have scared the crisis away, because like it's showing up at the mark. It was right when it was about to do it. It just said shoo. Like, it must have scared it all the way away.
Yeah, I mean, it's a real thing, man. It's I remember seeing it happen the first time, and it scared the hell out of me. I mean, it's a scary procedure, right? Just thinking about it, a needle going anywhere close to you there is a very scary thing to go through. But you know, when we talk about medicine, we talk about our approach to therapy. We always talk about benefit versus risk, right? So you can imagine that if we're saying, hey, the benefit of me taking a needle to you and draining blood is better than what potentially can happen if we don't, you can imagine that the outcome of priapism that's not going away is terrible, right?
Yeah.
And this is one of the things when we're talking about the stigma associated with the shame associated with talking about this issue, particularly for adolescents and teens. This is the one message that I think needs to be clear, is that we recognize and totally get that this is embarrassing and it's hard to talk about, but this really could cause permanent, long-standing damage, and to the point of even making you infertile, right? Like erectile dysfunction, not having parts that work. So it's so important to pay attention to these issues, because it does make a huge difference.
And I will say that nurses don't make it any better. If you talk to any guy that went to the hospital with priapism, they're going to tell you about 6-7 nurses all peeking in to see what's going on and stuff. And that doesn't make it any better, because you're sitting there, you already feel embarrassed, you already feel exposed. And it's like all of a sudden you're either a freak show or an enjoyment show.
Yeah, I'm really glad that you said that, James, because that was actually going to be one of my next questions. Because we all know somebody who actually basically was showing up to his pediatric hospital with these priapism episodes, and because of the reaction of the nurses, got kicked out of peds, because it was easier for the hospital to kick him out than to actually deal with the nurses who were harassing him. And that's disgusting.
Oh, wow.
And I'm so
because when I was 15, and I had grown nurses that wasn't even my nurse, wasn't even in that section, coming over, and they pulling the curtain by and stuff like that, to the point where my mom starts, like really cursing people out and stuff. And it's just, it makes the whole experience even worse.
That's terrible. I can't imagine. I'm so sorry. I wanted to know, I have 2 more questions and then I'm really finished. What has it ever affected you from like a dating aspect?
No, it didn't. Not a dating aspect, maybe sexually, because say if you get too aroused and you feel a little uncomfortable down there, it kind of makes you think back of other things. Like there was one time where I'm up, I'm thinking, okay, maybe I just need to relieve myself. So I sit there and try to have sex, and it was the most painful sex of my life. So it kind of messes with your mind, like when that happens, because you have flashbacks constantly, because you're like, oh, you're not sure now, like, okay, wait, this doesn't feel exactly right, wait, this feels too tight, hold on, like it starts to mess with your mind.
Wow, Yeah, I was curious about that because it was Demetrius who told me that was like his natural thing too, was to see if he could have sex and get it to go down, and that was like the worst decision ever.
It made it worse.
Yeah.
What happened was it seemed like it made more blood pool down there. It made it swell up more to the point where, you know how you get rug burn in your knees or something like that? It felt like that all around the skin. So it was like one of the worst decisions of my life. So now sometimes I second guess doing it.
Wow. Yeah. Again, I know that these are like incredibly personal questions, so thank you. I guess, obviously I have my own reproductive health issues, but I'm a woman, so I can't relate to this at all. But as the CEO of SC Red, I want to make sure that we're here for you. And so I guess my question is, we've talked about like the lack of awareness, the lack of education from providers, but what can we as an organization do, James and Ernest, for you guys to feel more supported?
I think it's too late for us. I think it's more for the kids. Like we already kind of damaged. So all we could do is make sure that the kids growing up aren't.
Well, I think awareness, just like what you're doing now, just more awareness, because I just learned a lot from James about his experiences. I never knew that type of stuff happened with the sickle cell, and I have SS. Same thing, he has, and we have two different experiences. So just keep spreading awareness, I think.
Okay.
For me, like I talked about, I mean, I'm going to ask you guys this, James, as you went to clinic as a child, as a teen, how many times did you talk about priapism?
Never.
What about you, Ernest?
Never, because it wasn't my main problem.
Right.
As a child was
right.
That wasn't really a problem for me.
Dr. Io, how often do you talk about priapism in the clinic? Well, you know what? That's not fair. Let me tell you my answer first. So my answer is I didn't start really openly and very clearly talking and asking about priapism until I met Demetrius and Hertz. Once I met those guys in 2017, and at a men's, there's like a men with sickle cell conference. Once they told me their stories, that changed me as a physician, and it became something that I ask all the time. But before that, I was too busy focused on the brain, the lungs, right? The kidneys, right? You're worried about the eyes. So you don't. What about Dr. Io? What is it? Do you share that experience?
Yes, I share your experience. So one of my closest friends back in Nigeria before I came to America was one of the top students in our med school. He had sickle cell disease, SC genotype, and he had episodes of priapism. So he was the one that taught me all about this. And when I started fellowship, I would ask all my patients. And it turned out all the male, because I would seek out male patients, male individuals with sickle cell disease. None of them had ever had a conversation about priapism at this great institution. And the kid that I presented in the talk, it was after I just randomly asked that he and his mother looked at themselves and they were like, yeah, he's been having this for almost a year. And I think we need to re-educate even the medical folks, not just doctors, nurses, like you say, everybody involved in all aspects of care for individuals with sickle cell disease about these complications so that they don't just hit them when it's already irreversible, so that we can try to prevent it. I think it's very important.
Right. And I'm glad that you both spoke to that because, just in my short time of leading this organization, when I've had conversations with other physicians, like, don't feel bad, it's not just you. A lot of them have said to me that they have to focus on preserving organs and keeping their patient out of pain, and that they don't often have time to address the reproductive health parts. And I think that, kind of like what James was saying earlier, it really speaks to where we've been as a community, because we've had to prioritize survival and basic awareness and education. And like Dr. Z and I have said, reproductive health is almost like a disparity within a disparity in sickle cell. And but have no fear, SC-RED is here, and we're here to change all of that and really make sure that we hold not just doctors, but the nurses and these other organizations, policymakers, hold them accountable and let them know that, reproductive health is a part of your overall quality of life.
Yeah, I'm glad there's talks like this. I wish there was stuff like this when I was younger.
Yeah, and I hate to hear you say that you feel like it's too late, because I don't think that it's ever too late. I'm here, and we'll have conversations offline about how to support you. And, one of the things I've been thinking about is starting like a mentorship program, largely inspired by a lot of the men in this community that I've spoken to. And so, yeah, we'll talk offline.
Okay, I appreciate that.
So look, guys, I mean, look at this example here, right? Where priapism affects about 1 in 3 men with sickle cell disease at some point in their life, right? And it's probably higher than that. And we've got that example right here with Ernest and James, right? With James saying this was a big issue for him and Ernest saying, you know what, not really, but still important for Ernest to know about, right? So going to your point, James, as we're ensuring that we continue to do a good service to the young generation ahead of us, it's important that we make it, really comfortable for mothers, fathers, and kids to talk about priapism, to understand that, there is some shame in talking about your, sexual organs, but with sickle cell disease, we really have to have this conversation, because this could have long-standing impacts on someone's life. I see there's a question here about the age of the youngest patients with priapism. In my clinical practice, I don't think there's great data on this, but in my clinical practice, I had patients, I would say, really it starts becoming evident as they are hitting puberty. So on the early side of puberty, in that 10, 11, probably the earliest I've seen it. What about you, Dr. Ayo?
I was going to say 10 is the youngest I've also seen, but once it hits around the time of puberty, all of a sudden it starts to stack up.
Yeah. That's interesting. I'm glad that somebody asked that question, because I've been thinking about this too. We had a mother come to us who was feeling like really overwhelmed and desperate, because she said that her toddler had been having episodes of priapism, and that the doctors were just totally overwhelmed because he was the youngest they had seen.
Yeah, that's.
I don't even know how you help that one. Wow.
Yeah.
No, that's really tough.
Can I ask y'all something, doctors? Just one question. How come most doctors don't sit there and try to talk to us about any of the complications of sickle cell until it happens?
Yeah. Wow. That's a loaded question, my friend. So I think, there's one thing about sickle cell physicians that we should talk about. The one is that I think most sickle cell doctors have good intentions. I really do. I think that the experience that the bad experience most sickle cell patients have with the healthcare system happens in the emergency room, right? And on the inpatient service, which often isn't your sickle cell doctor that you're seeing when you're feeling okay, right?
Right.
I'll give you an example of what was happening in my clinic. So in my clinic, in one hallway, we had sickle cell patients that were being seen, and I had 1,000 of them, with one nurse in 4 rooms. Okay. The hemophilia team was in the next hallway over, and they had 125 patients with 4 nurses and 3 doctors. So where my schedule looked like 20, 25, 30 patients for the day. Theirs looked like 6, 4. And I think what you see then is when we get in the room, it's, let me talk about your brain, let me talk about your heart, let me talk about your lungs, let's talk about your pain, and then we're out of time, right?
Right.
And this is why I started Cheat Codes, the podcast, because I realized that I didn't have enough time to talk about the things that were important. So then I would start telling patients like, hey, I really want to talk to you about hydroxyurea. Go listen to episode 4 of the podcast. It's an hour about hydroxyurea. Or I really want to talk to you about acute chest syndrome. Go listen to episode 10, right? And that's how I extended my clinic. But I think that's the reason. The reason is that sickle cell physicians are under-resourced. They are treated poorly by their hospitals. I mean, even Io, who is at the Disneyland of hematology at St. Jude, can probably tell you that the way that the resources sickle cell patients have, even there, are probably not the same as the ones as the pediatric cancer patients have.
Yeah, that's true. I get what you're saying.
But that doesn't make it okay, right? Which is why organizations like SC Red that help us extend that ability to really create awareness are going to be so important.
Because even when I had priapism the first time, after I had it, it was like, okay, you had it, that's it, it's over, and nobody ever talked to me about it again. I didn't really learn about priapism until Google and everything came out. That's when I was able to actually learn about it.
Wow.
Yeah, that's crazy, right? I'm glad you empowered yourself, though.
Yeah, I feel like you both just gave me an opening. I'd like to put in a shameless plug for SC Red that we are, before the year is over, we're releasing a master class. I have one for the women on preconception and pregnancy, and then I have one coming up for you, James, Ernest, all your friends, about priapism, about sperm count, about fertility, hydroxyurea, all of that. So be on the lookout for that. And then I see there's a couple comments in the chat about from Carrie, whose son started at 1 year old, and it's become like a weekly issue. And I don't know how to put my contact information so she can see it, but I really want Carrie to reach out to me so we can figure out if there's any way that we can support.
Okay, awesome. So T will put her contact information there, and yes, please reach out. Reproductive health is a right for male sickle cell warriors, as much as it is for female ones, and certainly that is something that she is dedicated to addressing. Look, guys, James, Ernest, Dr. Io, I mean, the sessions like this are what is what we need to drive the field forward. Having doctors, having doctors and patients in the same room as community advocates is the best way forward. I'm so happy we were able to have this forum. Tiana, I'm going to pass this to you to close this out.
Okay, well, I just wanted to thank everybody for joining us. Like I said, a lot of times I feel like when we have these conversations around reproductive health, the guys kind of get left out of the conversation. So thanks to Dr. Rowley and the Cayenne team for letting us close out on priapism. I know that I learned a lot, and I think that it was really therapeutic for our panelists to be able to come up here and talk about their experience. And, I hope that SC Red is able to kind of bridge some of these barriers and gaps that we heard about today.
Thanks so much. I think with that, we're going to have Mary come back and hey, Mary.
Hello, everyone.
Hey.
So thankful for everything. I think it's been an amazing seminar, so productive, all the questions. I'm so amazed about the situations that our sickle cell warriors go through. This conversation has so much to go through, and we still have so much space for more questions. So I really invite you all who are present in this seminar to leave your emails in the comments, in the chat, And of course, we will have this conversation. It is recorded, so you will be able to rewatch it as needed. It's so important. I will share, if Tiona allows me, I will be sharing her info. So you, if you have any further questions, she will be able to connect you with both Dr. Ayo and Dr. Saidi. It's an amazing conversation, and I'm so thankful for this. Tiona, I'm really looking forward to work with you for 2023 and do so much more around this kind of conversations for males, and to bring attention and awareness plus education. Thank you so much.
Thanks, Mary. Yeah, 2023 is going to be insane. So I'm ready too.
It is. Thank you, everyone, for being present. I truly humble for having you, truly honored.
Thank you. Bye, everyone.